Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our Facebook Live events. Today is January 22nd. This is almost exactly a year from the first case in the U.S. that we really understood what was happening with COVID, and it has been quite the incredible year. So again, but today is a time for you to go ahead and ask questions and for us to try and answer those questions. So we'll go ahead and do it. As typical, we'll start with the view in the world and then the view locally, and then we'll take questions that we gathered from the last time or didn't get to the last time, and we'll try and get there. So in the world, still an active pandemic, although it may be slowing. 98 million cases, 2.1 million deaths. I think over the last week or so, the cases in the world, the case growth has been slowing, although deaths are rising. We had 17,000 deaths in the world yesterday, but it looks like cases in the world may have peaked and are slightly coming down. Still very active in the U.S., Spain, the UK, Portugal, the Czech Republic, and in Israel, sort of a scattering of places in the Western world. Still pretty quiet in the Pacific area. Still unknown in Africa. Not a lot of cases in Africa, but we worry that there may be lots of cases and they just aren't picking them up because they're not doing very much testing in those areas. In the U.S., we're at about 25 million cases, 420,000 deaths, yesterday was our highest death count ever. Still very active in California, Arizona, a little swath in Texas along the Rio Grande River, South Carolina, and New York, which had been pretty quiet for a while, is now starting to see increased activity. Also in Connecticut, Rhode Island, Massachusetts, starting to see some increased activity. In the U.S. overall, cases are, I think, now really declining. I think on Tuesday we said they're beginning to decline. I think they really are declining now. And hospitalizations are declining from a high of about 130,000 hospitalizations in the country down to about 128. So not a huge decline, but it's at least coming down. And death, the increase in deaths seems also to be flattening. So that is all good news. In Oregon, we're at 135,000 cases, 1,800 deaths. And again, in Oregon, hospitalizations, cases, and deaths all seem to be declining. In Douglas County, we reported a new death today, and we're continuing to have cases, although the cases in Douglas County peaked in November, then went down in December, peaked again after the holidays, and seems to be coming down again. So I know there's a lot of questions in there about vaccines and everything else, and we'll get there. The one question I have is there's somebody who wrote to me that they'd asked this question that didn't get answered. If you could ask that question again, we'll try and get to it today. Oh, shoot. Okay, let me get to you here. All right, here it is. So Amy asked the questions. Could I explain the warning weeks and shutdown numbers? How are they determined? So the way they're determined is they're determined over a 2-week period that starts Sunday morning at 12:01 and then goes to midnight on Saturday night. 1 week is a warning week, and the next week is what's called a movement week. We are nearing the end of the movement week, and so we look at the number of cases that are counted from last Sunday to this coming Saturday, so for that 14-day period. That number is then divided by our population in the county, which is 112,000. And if we're under 200 cases per 100,000 over the 2-week period, we can be in the high range. If we're above, we'll be in the extreme range. We are exactly on the razor's edge. When I look today, we are exactly on the razor's edge, and it'll all depend upon how many cases are reported through tomorrow. It's going to be very confusing because there's going to be a major systems upgrade on Saturday, so they're not counting cases on Saturday, so we don't know how this is going to work on Saturday, but as I said, we're right now on the razor's edge of doing it. So again, we count from Sunday morning to Saturday evening over 2 weeks, divided by 112,000, that's the number of people, and then we get the rate per 100,000. So we'll see. So lots of questions about vaccines. So let me go through some of them. So it sounds like on a global scale there has not been enough vaccine produced. Absolutely true. To vaccinate the world, we're going to need billions of doses, and only tens of millions have been produced so far. So the problem is these are all new vaccines, and they take a while to develop. And they are apparently working as hard as they can at Moderna and Pfizer to get these vaccines going, but they can only produce them so fast. In addition, Pfizer is a multinational company, and they made arrangements with lots of countries to give them vaccine, the U.S. being only one of them. And we had this weird little tiff with Pfizer in December. Early on when we did this, we had an opportunity to buy more Pfizer vaccine, and we didn't. And then in December, we had this ugly little deal between the government and Pfizer. We got a little bit more vaccine, but that's going to come over a relatively small period. So the big problem now, far more people want vaccine than we have vaccine, and it's a global shortage. Actually, the U.S. has one of the better supplies. There are some countries that haven't had any yet. So, for example, Japan has given nobody a vaccine yet because they don't have a vaccine. So it varies. There are some countries in the world, small countries like Israel, who actually purchase a lot of the Pfizer vaccine, have done better on vaccinations. The U.S. is somewhere kind of in the middle in the vaccine race. So how is it Douglas County to complete vaccines in the 1A group? So the 1A group in Douglas County, we think, has about 12 to 15,000 people in it. Every day, the definitions of who counts and who doesn't is changing. And I spend a good portion of my day telling, for example, this week that defense attorneys were not included, but that veterinarians were included. And so we're doing a lot of parsing here of who's included and not. But we think there are about 12 to 15,000 people. We think in Douglas County we've given about 3,000 doses of vaccine. Most of that is first dose, because remember, you have to wait to give the second dose. So we think about 3,000 people have done it. So we think we are probably about, and of the 12 to 15,000 people, there are a lot of people who don't want it. So maybe 50% of people want it. So we are about halfway through the people who want it in 1A. As we said, we're going to have a big event tomorrow. That'll get us there. We've had a few large releases of vaccine this week. So we're likely to get there, I think, substantially through the 1A population by early next week. And the numbers would be nice, but there's so many unknowns in the numbers, like how many people want vaccine, to know how far you're there. We can tell. We opened up a standby group for some of the vulnerable populations in 1A, and we've gotten some response, but it's not overwhelming, suggesting that we're doing a fairly good job in moving our way through 1A. After the 1A comes the teachers and other educators, and then after that comes the seniors, and we really want to get there because we know that our seniors are very disproportionately affected by this disease. So then it looks like teachers and educators will be there with the kids. The kids are not going to be vaccinated. It's not going to be the kids. It's going to be the adults that are with them. And so we've just started with that group. I think today was the first one that we've given in that group, and that will happen over the next 2 weeks. The problem is they keep adding people to that group, so I don't know how many are in it, but we think there are about 4,000 or 5,000 in Douglas County in that group. And so it's going to take a while to get them all done too. And he says, then maybe it's us old farts. And so next week I become an old fart, or next month I become an old fart with you guys. Does anybody know when trying to protect us? So, and clearly everybody in government understands this. And the sequencing in Oregon that put teachers ahead of seniors has been very controversial. I think the reason is that we really want to get kids back in school this school year. If we went seniors first and then teachers, what would happen is there would barely be time to go ahead and do anything in this school year. And I think there's a real desire to have kids back to some school this year. So we think this is going to delay the seniors by about 2 weeks. And granted, that is 2 weeks too long, but I can see the rationale for doing it this way. There are lots who will not agree with that. So we'll see. The good news that we've seen is the vaccine seems to be incredibly safe. There's been about 1 in 10,000 people that had an allergic reaction, but in all of them, the allergic reaction has been able to be easily treated. Some people have wound up staying in the hospital, but in general, this has been an incredibly safe vaccine, and the data on efficacy, as every time we look at it, continues to be just as good as we see. So what we've seen actually is that people got the disease, that a number of them have gotten the vaccine. A number of them have gotten disease in the first few days after they got the vaccine. Not from the vaccine, but because they've been exposed before they got the vaccine. But after 10 days, we're not seeing any cases. So that is a really, really, really good thing. The second question is about kids and COVID. So is it standard protocol for doctors not to test kids because the diagnosis wouldn't change the treatment of their illness? So the story is on testing. The testing's up to your doctor. If they want to do the testing, yes. If they don't want to do the testing, no. Early on, when tests were really scarce, really hard to get, we were saying don't do a test unless it's going to change what you're going to do. So early on, it did make a difference if somebody's going to be hospitalized, how you would need to isolate them. It did make a difference for those reasons, and those people were tested. But many people early on were not tested. Now testing is available, and we're recommending that people test anybody who's symptomatic, but really it's your doctor's choice. Now, it does not make a lot of difference in kids, right? Because if they have COVID, they're going to be at home. If they don't have COVID, they should still be at home. They're very unlikely to be sick enough to be in the hospital. So the diagnosis doesn't change a lot. We would like to know if those kids are positive. So we have been asking doctors to test, but it really is their prerogative. They said they've also sent their kids to school since the kids didn't have a COVID diagnosis. Ugh, that's wrong. The kids, if they were contacts, should stay home because they should be quarantining and they shouldn't be in school. So Gabrielle says, I'm wondering if the vaccine prevents a person from spreading COVID in addition to preventing them from getting it. So we do know very clearly that the vaccine does prevent severe illness, almost perfectly. It prevents illness, any symptomatic illness, more than 90% of the time. The studies were not set up to figure out about asymptomatic spread. Those would be really, really, really hard disease to do, right? So I'm not even sure how you would do it. And so asymptomatic disease was almost impossible to test for, and thus they did it. That being said, we know that people with symptomatic disease and pre-symptomatic disease, that is, people feeling fine but are going to be sick tomorrow, are far and away the most contagious. People who remain asymptomatic during their entire course don't seem to spread the disease as much, and thus we do think the vaccine probably prevents you from spreading in addition to getting it, but we do not have the data on that. So where can Douglas County's 2-week dates and counting tally be viewed each day? There's really not a good way, because what will happen is that cases will get added sometimes in retrospect, and sometimes they'll get added in the future. We do report the tests that we get every day, and ours is extremely accurate. But, as we said before, we'll sometimes, in our tally, know about cases way before the state, right? So there's a positive case at the urgent care. They call us up in the day. The state may not get that report until the next day. And then on the other hand, there are other cases that are reported from another state. Let's say I was traveling to Mississippi and got sick. The test gets recorded in your place of residence. So the test would be done in Mississippi. The results from Mississippi would be sent to Oregon, sometimes not for a few days, and it would get to Oregon. And so there's a lot of vagaries in the numbers. Now I will tell you, overall, our numbers and the state numbers are almost exactly the same. Although with the little vagaries of exactly when they get reported, whether they get reported at 10 o'clock at night or 2 o'clock in the morning, it's hard to know. So for example, if we got on our Saturday case report, we think that's all the cases. But then if there's a case that comes in the day from an urgent care, we'll record this as one of our cases, but the state may not till the next day. And so there's not a 100% accurate way. However, if you look at our numbers are never off from the state numbers more than a couple. And as I said, we're right at the razor's edge this time. So we'll take a look and see. We're right at the razor's edge. We've had far more cases than we should. And many of these cases have been, just shake your head. I mean, people who are sick going to work. We see this again and again. If you're sick, please stay home. So discuss the local church outbreaks. Well, we've had 4 outbreaks associated with churches. And they've ranged anywhere from small to really large. The largest, more than 60. It's a lot. And those cases in churches are important because people at churches don't just live at the church. They also work, they go home. And what happens then is those church outbreaks now spread into other businesses and other places in the community. To have 60 from a church is a lot. And it's because this disease, in many cases, you don't spread it to anyone. But then in some cases, there'll be one person who's really very contagious at the time. And they can spread it to many. And I will tell you that in general, the churches that have had outbreaks have been less stringent about the rules. We've had some very large churches in the community that have been very stringent about the rules. Spacing, avoiding singing, wearing masks and whatever. They've had no outbreaks. The churches that have outbreaks have generally been the churches that have been less strict about following the rules. And so what precautions should they do to be staying safer? Again, smaller crowd sizes, more distancing, wearing masks, avoiding singing events would make sense. And that's one of the things that we saw today. Turns out that of all of the activities that are likely to spread, the singing is at the top, talking is next. Coughing, which you would think would spread a lot, seems to be less effective at spreading disease than singing or talking. And it may be that people who cough are so shunned by others that people run away from somebody who's coughing, and thus they don't spread it to others. But that was interesting to see. Anne-Marie says, why is Evergreen saying they won't give out the vaccine and to contact you? So until this last week, they had not been an approved COVID provider. They are now, and they will be starting, and they have started giving vaccine to people in the 1A population. However, again, in the 1A population, we're asking people to sign up at vaccines@douglaspublichealthnetwork.org, and then we're going to send you off to different clinics to get that vaccine. Again, we're asking people not to call your clinics, not to call your doctor about getting vaccine in this phase. And if you are in phase 1A and want a vaccine, vaccines@douglaspublichealthnetwork.org. So Stacy asks about the second dose of the vaccine. I've spent a long time today working with the state and others about the second dose. We think when you look on both Moderna and the Pfizer vaccine that at about 10 days after the first dose, you get about 80% protection. By 7 days after the second dose, you get about the 95% protection. So after one dose, about 80%. After 2 doses, about 95%. And so the second dose totally helps. But the question is would it be better to give more people a single dose rather than half as many people 2 doses? And I spent a long time on the phone today talking about that. Right now, the recommendation is still for 2 doses. So Deborah asked a great question. My daughter believes it's safer to have a maskless gathering of a few people than to go to a business where everyone is wearing a mask and socially distances. What are your thoughts? Well, businesses where everyone is wearing a mask and socially distance is very safe. Again, I'm still trying to find a case here where we have people who did everything right and got the disease. So I think going to business where everybody is wearing a mask and social distance is quite safe. Having a party with 1 or 2 people is also quite safe. Think about it. We have at any one time, we have about 100 known cases of disease in this county. We know that we don't get everybody. There's some people who are asymptomatic. There's some people who don't get tested. So there's probably at any one time 300 people in the county who are contagious. Which means that there's about 1 in 300, about 1 in 350 random people who will have the disease. About 1 in 350 people who will have the disease. So if you go to the grocery store where there's 100 people there and people are wearing masks, there's a chance, about 1 in 3, that there's someone there. But if they're wearing a mask and socially distancing, your chance of getting it from them is very small, less than 1 in 20. So you now have a really small chance of getting it at that place. If you have a party with 2 people, the chance that one of those 2 people is going to be one in the 350 people have it is small. So again, that is reasonably safe, but not totally safe. So there's nothing that's totally safe, but probably an afternoon with 2 people and going out to several stores where not everybody wears masks and whatever, probably on the same range. But that would be if your only contact would be those few people. But if those few people then have party with a few other people, and they have party with a few other people, and then you have parties with these 2 today and these 2 tomorrow, these 2 the next day, every one of those is an additive risk. And again, nobody's risk is super high, but if you have 1 or 2 people at your house for dinner, and they're feeling well and they're not crazy about what they do, that's going to be reasonably safe. A party with 30 people is 10 times or 15 times as dangerous. Going to a bar where there's lots of people, not many people wearing masks, is more dangerous still. So, a gathering of a few people who are also safe is reasonably safe, but nobody could say 100%. So Stephen says, has there been any thought to continue school through the summer? That would certainly make a lot of sense. I've not heard anything about that. We know in the summertime the amount of disease goes down. We know that kids have already had, kids do need some time off, but they've already had a bunch of time off. So it certainly would make sense to do that, but I've never heard anybody say that. Okay, so acetaminophen, ibuprofen, and aspirin in the days leading up to a vaccination. Chad asks, well, none of those is a contraindication to getting the vaccination. There's some people who feel if they take Tylenol before they get their vaccine, they'll have less reaction. Certainly we hear parents say that every day. It's certainly no troubles on that. No issues taking those, but no issues also not taking those. I didn't use it when I got mine. Didn't seem to make a difference. So Casey says, given restrictions on international travel, how are the UK, South African variants showing up in the US? Well, there still is some travel. There's not a lot of travel, but there still is some travel that goes around, as well as it is really likely that these variants have been circulating for a while. And just by the kind of little travel that occurs, this is going to happen, right? So still, diplomats are going overseas. Still, other kinds of things are happening overseas, and that's how these things do tend to spread. Now, the problem, unfortunately, is that many of the cases that have been found in the U.S., when you go back, you can't find that the people who have it traveled. In fact, you can't even find that the people who have it were around people who have traveled. So it suggests that the cases in this country have been here for 2 or 3 or 4 generations. That's worrisome. So Carol says, my parents are in their 80s. Where do they go and when for their vaccine? So again, in Douglas County and in Oregon, we're following the Oregon sequencing rules. The Oregon sequencing rules are between now and the 25th. We're in phase 1A, healthcare workers, people in nursing homes, people in memory care facilities, and EMS. We are most of our way through that group, but not all, but most of our way through that group. Starting the 25th, it is going to be teachers and education personnel between the 25th of January and the 7th of February. On the 8th of February, it's going to start off with people in their 80s. I will tell you, we have absolutely no clue about how much vaccine we're going to get for people in their 80s. But our plan in Douglas County is that people in their 80s will get vaccine at their regular providers. So we have 42 providers set up in Douglas County. The names you'll know, Aviva, Evergreen, all those people who will get vaccines. And our goal will be that for people in the 80s, they will call their regular doctor and say, I want to get vaccine. Or even better, they may call you and say, we have vaccine. And then we would like people in their 80s to go to their doctor's office to get vaccine. Now, we understand there are some people in their 80s who don't have doctors. We understand that there are some doctors, just a very few doctors down, who don't have vaccine. We're going to have to make arrangements for them. But our general view is that you would, starting February 8th, you'd be able to go to your regular doctor and get a vaccine. So Bobby says, what is the number of infected currently that could lead to the potential extreme level again? So again, we have 112,000 people in the county. So we have more than 224 cases in that period. We'll be above that 200 level. When we looked earlier today, we were still below that level, but it all would depend on how many cases are found in the next 36 hours. Remember, the time goes until Saturday midnight. And so for that, we have 36 hours or so to see how many cases we're going to get. And again, it's varied, right? Some days we've had as few as 5, and then other days we've had as many as 25. So it's really hard for me to predict. So why are they so concerned about teachers? You keep saying kids aren't super spreaders, Veronica asks. And the reason we've been concerned about teachers is that we're asking teachers to go into a classroom with nobody else who's vaccinated. Well, any one kid is unlikely to be a super spreader. They're in a room with 30 other people. Actually, when I think about it, I've not been in a classroom-sized room with 20 people in months. And so we really are asking teachers to be in a group where other people are sick, and some of the teachers are worried that they could get sick from the students. And if they get sick from the students, some of the teachers who are older are concerned about getting sick. And that's why the decision was made in Oregon to put teachers in the front of the 1B section. It has been very controversial. I mean, ridiculously controversial. But it's what it is, and we try to follow along with the rules. Casey says, do we need more vaccinators? No. Right now we have far more vaccinators than we have vaccine. What we need more of now is vaccine. So why and where are the teachers getting the vaccine? Well, we talked about the why. The where is still being developed. I think some of them are going to get them in regular clinics. We may have another big event for teachers. Yeah. So Darlene said, are we posting the vaccines allocated and given by the various clinics in Douglas County? That would be nearly a full-time job, and because of the difficulties. So we have allocated the vaccines to a bunch of different clinics throughout the area. We are following up with them on a nearly daily basis to be sure they're doing those. The total number of vaccines that Douglas County has gotten has been allocated is something like 6,000. Although allocated means sort of like you've ordered on Amazon, and all of us know you order stuff on Amazon and you wait until it comes. So some of that stuff has been allocated to Douglas County, means like we bought it, but it's not here yet. So of the 6,000 doses, about 1,000 have been allocated and not arrived. You can't really expect us to give stuff that has not yet arrived. Of the 5,000 or so that's arrived, there are about 1,000 doses in waiting for people who've gotten their first dose of vaccine and are waiting the second dose. That dose is allocated for the second dose of the people who've gotten their first dose. You can't give that. Several thousand doses have been allocated to the Federal Pharmacy Partnership, of which we have no control. The total number of doses that we truly have control over are the public health doses. We got 1,500 this week. Before that, we'd gotten a total of 900 doses. We think every single one of them was gone. The 1,500 doses arrived this week on Wednesday. They've all been distributed to the clinics. And for the most part, the clinics are giving them today, tomorrow. So, for example, one of the smaller clinics that got 50 doses is doing a special Saturday event to go ahead and give out the doses. So really, these are not sitting around anywhere gathering dust. Some are sitting, waiting for the second dose, which we're told we're supposed to give. Some are some are just, for example, the doses that are scheduled for the event tomorrow are sitting in a freezer today to give to the event tomorrow. It's pretty hard to. You had to plan these events, right? So for this event that we're having tomorrow for those high-risk populations. It took a week or so to prepare, to get the place ready, the people ready, all of those things ready, to get people signed up. And so that's why not every one of those is given. Think about something else. I mean, think about, like, for example, the gasoline supply in the United States. In the gasoline supply in the United States, there's some that's in trucks, there's some that's in tanks, there's some that's waiting, there's some in your gas tank that you haven't used yet. And what we're trying to tell people is that, you're not going to get to the point where every dose can be given, because there's got to be some in the pipeline. What I will tell you, however, is that Oregon is doing very well. When I looked at the list today, we're the best performing state in the West and one of the best performing states in the country in terms of using the vaccine that we've been given and giving them out. So do we know the maximum time between the dose of vaccine? We know that at least 6 weeks is fine. And like most vaccines, forever is fine. So there is no maximum, there's no stated maximum time between the dose of the vaccine. And we know in pediatrics, I mean, this is what we do in pediatrics, give out vaccines. We know that kids frequently don't get their booster doses at the time they're supposed to, and they seem to work perfectly well. So, this one was tested giving the second dose at 21 or 28 days because they had to get they had to get the study done. But we think this vaccine, like other vaccines, there's no really maximum time to get the second dose. And so some people have suggested that we do is get more first doses into people, and then when we get more first doses into people, get through the seniors and the teachers and everybody else, then we catch up on the second dose. I think that's reasonable. We'll see what everybody else says. So why is the strain in South Africa so bad? Yeah, so the strain in South Africa has a change in the way this adheres to the cells or binds to the cells, and it seems to bind much more avidly, and because it binds much more avidly, you're much more likely to get it. So when you think about what this is, it's sort of like these viruses float around in the bloodstream, or they float around wherever they're going to float around. They have no legs or wings or whatever to move them around. They just kind of float around in what's going on there. And then if they happen to get close to a cell that has the receptor for their protein, they connect and they connect. And then the virus, through that connection, injects itself into the cell, and by injecting it into the cell, causes an infection. What we think happens with the South Africa virus is that it binds much more tightly to this receptor. So you could imagine if it didn't bind very, very tightly, it might get close and then bounce off again. In this case, it binds very tightly, so we think it gets sort of stuck together and can infect the cells that much more. So Veronica says, I heard there were child deaths in Texas from COVID. Indeed, there have been child deaths from COVID everywhere. So children get this disease, symptomatic disease, less often, although asymptomatic disease probably as often. They get the symptomatic disease less often. They get really sick less often, but they still get sick. And we think there are going to be as many childhood deaths from COVID this year as there are from childhood leukemia. I mean, so we think childhood leukemia is important, and there are probably going to be about as many deaths from COVID in children as there are from childhood leukemia. Still a relatively low number, but it's still very concerning. And again, Texas has just been incredibly struggling with this disease. So if you look at the heat maps, Texas is just fiery hot. So Janet says, will we ever be able to stop using masks? Yes. So yes. So when we get this disease down where we have community immunity or herd immunity and the amount of disease is low, I think we're going to be able to go to theaters again. We're going to be able to take our masks out again. Although I will tell you that by people socially distancing and wearing masks, we've seen a remarkable decline in the amount of flu. So when I looked at our last flu report, there are only a couple of cases of flu in the whole state, as opposed to thousands before. So the masks really do work to prevent disease. And it may be that masks become more of the routine. Having lived in Japan for a while, wearing masks was not like, oh, you only wear a mask when you're sick, when there's a COVID outbreak. People wear masks all the time. So it may well be that they may become more mainstream. I don't know. So Travis said, I've heard someone develop tachycardia issues after the second shot. I'm getting my first shot tomorrow and already have tachycardia issues. So tachycardia means a fast heart rate, and fast heart rates can come from an arrhythmia, an abnormal electrical impulse in the heart, but tachycardia can just come from being nervous or exercising. So my pulse is probably not very high, but if you had stage fright and looked at the pulse of somebody who was doing a live event like this, their pulse might be 110 or 120. Mine's 80. But their pulse may be up because they were nervous. We know that there are a number of people when they get this vaccine are incredibly nervous and their pulse goes up. So a doc was telling me yesterday about an event, and they gave it, and this person had this terrible tachycardia, but it was just from nervousness, and they talked to him a little bit and it came down. So with the tachycardia issues, clearly there's going to be some risk. I would certainly have you talk to your doctor about whether you should get it. So Cassie says, I have a ticket for tomorrow. Yes. We'll be told where to get our second dose tomorrow. You'll be given a time for your second dose, like your second dose should be it's this Pfizer vaccine, so it's going to be 21 days after the first. However, we have not gotten the dose. That second dose is supposed to be being set aside, but in 3 weeks, we have no clue about what's really going to happen. So yes, you'll be given a time for the second dose, but you're not necessarily going to be given a specific appointment. Okay, a couple of people time to get more questions in here while they're doing it. A couple of other things that we saw was about the vaccine and the variant. So the question is, on these variant vaccines, are they going to still respond as well to the vaccine? We don't know. We think that for the UK variant that the Pfizer vaccine works just as well. But as you further change the shape of this spike protein, the vaccine may work less and less well. Now, the good news is that these vaccines, rather than having you make one antibody, you make multiple antibodies to the protein they make. And even if one or two of the antibody types don't work, there still are probably enough other antibody types that it's going to go ahead and protect you from the disease. Now, there was a report yesterday that the South African variant is different enough that people who previously had an earlier variant of the virus are still susceptible to this new one. That would be worrisome because that would suggest that the antibodies that this has changed enough that the previous antibodies you made aren't going to work, and that would be worrisome. But again, these variant viruses, these mutant viruses occur because there are lots of infections close together. So again, in the mink farm, you can imagine 100,000 mink together sharing these viruses that if one variant develops and it's a little bit stronger than another variant, it's going to be the dominant virus, and then it spreads among the other mink. And in just a few generations, what you've done is you selected out for the hardiest variant. And that's the big concern. And when there's so much disease in the UK, so much disease in Spain, so much disease in parts of the US, you worry that these variants are going to develop. And it's not surprising that the variants have all developed in areas where there's lots of disease. The UK, Brazil, South Africa, California. And you haven't heard about the Oregon variant because we just don't have that much disease circulating. So the key to stopping variants is stopping the disease. And the way that works for all of the variants is mask distancing, staying home when you're sick. So we would really, really, really encourage people to do it. Again, another question that came up was about, explain again how these variants work. So what happens is every organism, bacteria, virus, human being, when we divide and replicate, we now reproduce our DNA. And when we reproduce our DNA, we're usually very good and very careful about getting it exactly right. But inevitably, a little typo shows up. And in humans, these typos show up, and then they cause new disease. So many of the genetic diseases we see, like neurofibromatosis or things like that, develop because there's a mutation in what goes on. And then that mutation can get carried on forever. So for example, the sickle cell mutation was probably thousands of years ago in Africa and then spread to other places, and now there are people who have it. The gene, for example, for cystic fibrosis, we think, and there are several genes that for cystic fibrosis developed in Europe. And one of the things that we think happens is that people who have one of the genes for cystic fibrosis are much less likely to die from cholera. So you could imagine that this variation would be in a bunch of people. Cholera would come through an area. It would kill off all the people who did not have this variant, and the people who remained had this variant, and then this variant would spread and spread in the community. So now there are a number of us who carry the variant gene for cystic fibrosis, and then we happen to marry somebody who's also carrying that variant gene. 1/4 of our kids will have cystic fibrosis. And that's how these things spread. So this is nothing new or different. We've known about this for a very long time. Viruses also mutate. Some viruses mutate very quickly. HIV mutates incredibly quickly. A good percentage of up to 10% of the offspring of the HIV virus are mutants. Now, most of them are silly mutants and they die off, but some are mutants which give resistance to certain drugs, and that's why HIV was so hard to get under control for so many years. Now HIV is much easier to keep under control because there's far fewer people who have lots of virus and so far few replicating events. Well, this virus actually mutates in comparison to other viruses slower than most because it's got a little bit of a proofreading mechanism. Some viruses mutate very little at all, like measles, and then some mutate in the middle, and this one is in the middle towards the low mutation side. But the problem is going to be that with this much disease out there, especially in concentrated populations, it can spread. And again, most mutations are going to be a tiny change that's not going to make a difference. Some are going to be changes that make the virus less likely to infect you, in which case they're going to die. They're not going to reproduce. But the rare one will make it better able to reproduce, and by being better able to reproduce, it's going to spread. So I use this recipe thing. So imagine you have a recipe for cake, and your idea is you're going to make this recipe, and then you're going to send it to 5 of your friends. They're supposed to make it, and if they like it, they're going to send it to 5 of their friends. If they don't like it, it's going to die off. So imagine the recipe, and you make a mistake, and when you're copying it, you spell vanilla with 1 L. That's a change, but it's not really an important change. And the people who get it in the future, it's not going to make any difference, and it'll just go on. Most of the mutations of this and most viruses are like that. And there are thousands of them. I mean, when I looked last, there were 4,100 different ones of those nonsense mutations. An occasional mutation will be really bad. So instead of a teaspoon of vanilla, it copies as a teaspoon of Tabasco. And then the 5 people get that, say that's the worst tasting cake we've ever had, and it goes away. However, there could be one where the mutation, instead of having 1 teaspoon of vanilla, it would have 2 teaspoons of vanilla. The people would taste and say, you know what, that cake is really good, and they would spread that one on. In fact, they'd spread it on faster than the people with the 1 teaspoon of vanilla. And after a while, if you looked at all the recipes for this cake, they would mostly have the 2 teaspoons of vanilla. And that's how these things spread. And if you had somebody who was more likely to spread it to more friends, it would spread quicker. And that's why we think this is how we think this happens. Again, the most important way to stop this is stop spreading the recipes, and that would be wearing a mask. So Ronnie says, I'm 69, tested positive for COVID in December. I'm good now, but would like the vaccine. So the story is, in people who've had the disease, you can get the vaccine. However, we're saying with a limited amount of vaccine, since you likely have good protection for 3 months, that you might want to wait 3 months to get the vaccine. And allergic to IVB die, there were some of the people who had allergic reactions who had allergies to die. And so, again, it's a little bit increased risk, but not so much an increased risk I wouldn't have to get the vaccine. So in your situation, I would suggest you maybe wait until there's more vaccine available, and then be cautious, but still get it. Yeah, so David says, how is vaccine allocated to the counties? The state says we have the lowest vaccination rate. Are we getting less vaccine? We're getting less vaccine. So I actually did the numbers today. And so the state, when they've allocated vaccine, in the beginning allocated a lot of vaccine to large health systems with the idea that large health systems could distribute the vaccine faster than lots of onesie-twosies. I'm not sure I believe that. So a lot of the vaccine went to Multnomah County, a lot of the vaccine went to Marion County, and much less came to Douglas County. So I looked at this today, and I looked at the different areas in the state that have different amounts of vaccine, and almost all the areas in the state have given a similar proportion of the vaccine they got. So, for example, Marion County got about 3 times as much per capita as Douglas County, and they've given about 2.5 times as many per capita vaccines. So again, we're relatively low on the number of vaccines given, but we're also relatively low in the number of vaccines allocated. Some of this is that we've not had these huge caseloads for a long time. Some of it is we don't have a huge hospital system here. I think it's going to catch up, so I think we'll get there. So Sky says, Dr. Offit thinks does not think 1 dose enough. No, I would totally agree that everybody should get 2 doses. The question is, should they get 2 doses a month apart, or could they get 1 dose now and get another dose later? You know, we did this complicated modeling about this, and the question is, when do you reach herd immunity? So if you give everybody gets the vaccine 2 doses, we don't think you reach herd immunity until Christmas or later. If you give people 1 dose, you get herd immunity in September, and then in September could start giving people the 2nd dose. So it's a very complicated, very controversial decision because Offit thinks no, but Wachter thinks yes, and Jha thinks yes. And so this is really a brisk debate. And I was on the phone this morning with a really good conversation with a bunch of smart and well-meaning people. And I think we came into the end saying, oh, this is really, really tough because we're working on something less than perfect data, right? So it would be nice to have lots of data on people who didn't get the 2nd dose for 60 days or 80 days and see what their response was. That would be great. So yeah, we've looked at this data, and I think it's not totally clear. So typing here. So people who don't have docs may have trouble getting a vaccine. Well, so again, we think that people who have doctors who are vaccine providers will have a very easy time of getting vaccine. We will come up with strategies for people who don't have docs. But again, really people who are old should have docs. I mean, we've talked about this now for almost a year, that one of the great things you can have in your life is a primary care doctor. So when they say, well, talk to your doctor about this, talk to your doctor about that, you have somebody you can actually talk to. And you can actually ask them the question like, hey, I'm 69, I've got IBP, and I'm allergic to IBB dye, what should I do? That would be the time to ask your doctor because they would know what your reaction was. They would know about your other physical state. I mean, I don't know any of these things when we talk. So again, the very best thing is to have a doctor, and there are some doctors in town who are taking new patients, so we would do that. But that's not going to happen, you know, this is a long-term problem in the American healthcare system. You know, other countries have this. In England, people all sign up for primary care doctors, so everybody has a primary care doctor. And the idea in England that you don't have a primary care doctor is weird. It's like, what? You don't wear shoes? I mean, it's such an unnatural thing not to have a regular provider in England. In this country, not the case. There are a lot of older, you know, there are a lot of people, especially young people, don't have doctors, and I think that's a crying shame. However, we're going to work really hard through our providers to be sure that everybody who's eligible for vaccine gets it. So, quicker, cheaper test that wasn't invasive. Can Can you speak to that? I think I said less invasive. So originally, the only tests we had were a test called the PCR, or the polymerase chain reaction tests. Many of those tests required a deep nasopharyngeal swab, which is that swab that goes in your nose for 5 inches. So if you've never seen it done or had it done or watched it being done, it's horrifying the first time you see it. You cannot believe you can go in 5 inches, but you do. So those tests were more invasive. Nobody liked having it done. They were slower, more complicated, and more expensive. The newer tests are called the Binax tests. There's a couple of other brands, but Binax is the one we're using the most. This requires a swab just of the front part of your nose. You can actually do it yourself under the supervision of somebody watching you. And it's $5, and it's 15 minutes. So the old test, deep swab, couple of days, $200, more accurate. But this other one, these newer, cheaper tests, 15 minutes, you can swab the front of your nose, $5. And so there's time for each of these. We think for symptomatic people, we would always suggest one of the more rapid tests. There are a couple of populations that we are still recommending the PCR. And because of that, we used to be doing the PCR testing twice a week at the fairgrounds. We've now gone down to once a week and putting much more of our energy towards vaccination. All right, so it's 4:50. It looks like this is the time. We're going to do this again on Tuesday. In addition, we're going to do a special Facebook Live starting at 1 o'clock tomorrow. This is going to have 2 things. Mostly what we're going to be doing at that Facebook Live is we're going to be telling people who are on the standby list for tomorrow's event whether they have a space or not. So there are people signed up for the standby starting at 4 o'clock and going till 6:30. And what we're going to do is we're going to say, for example, everybody with a ticket before 5 o'clock, you're in, and so that they'll know to come. In addition, we'll reach them by email and by phone so that they'll know that they're in, but we'll do that. And also during this time, if people have questions, you can put them up and I'll try and get to them as best we can, although we'll have a lot of work to do tomorrow, so I may not be able to get to all of them. Again, I think Douglas County is doing a great job. We're right on the razor's edges, whether we move from high to extreme. I'm keeping my fingers crossed that we're going to stay in the high range. General people are doing a really good job. Just a couple of things. Please wear your masks. Please socially distance. And please stay home if you're sick. And first and foremost, be safe and be kind. Thanks.